Olivia Butler is the Communicable Disease Program Supervisor at the Wicomico County Health Department, and she joins us this afternoon to talk a little bit about what everyone is really talking about. Now, you've had a kind of a crazy couple days, I imagine, with your job.
Yeah, it's been very busy.
Yeah. So we want to ask some questions. We reached out to some of our viewers, and they had questions as well. And this is one I feel like social media is jumping all over, saying flu kills more people every year. Why are we worried about a disease that doesn't have half as many deaths?
Well, the reason that we are looking at this more so than the flu right now is because it is a new type of coronavirus. So it may not be causing as much sickness or death as compared to the flu, but it is new. So we probably don't have any type of immunity to it. So that is what is causing people to get sick when they get it.
Oh, okay.
So anytime that there's something new, we're looking at it to see what we can do to prevent it or to get ahead of it in the future.
Sure, because there's a lot of unknowns. Right. Okay. How is this different from all of the other epidemics, different from SARS and avian flu? Because SARS is a coronavirus as well, right?
Yeah, I mean, it's not really that different. In that it is a different virus that we're looking at, but the things that we're doing as far as what we've been doing the past few weeks in preparing for it, and us working with different agencies in the community and with the county, it's not any different really than what we've done in the past with H1N1 or Ebola or any of those other things. It's things that we've planned for, and we have plans in place for a while.
Yeah, and that working together is important,
Right.
isn't it? Yeah. And you're watching what's going on around the country and around the world as well?
Definitely, yep.
Yeah.
We're looking at that several times a day to see what's going on.
Sure, yeah, because we were just talking about how it just seems like it's changing constantly.
Yes.
Yeah. All right, can we test for coronavirus on Delmarva?
We can. The testing is done at the state lab, or there's a couple commercial labs that now can do the testing. It's a specimen that's collected through a nasal or oral swab. So it typically would be collected in the doctor's office and sent to one of the labs or to the state lab. Now, there are some testing criteria that we would like people to meet to get tested so that the labs are not bombarded with people just coming in and wanting a test.
Yeah.
If they're not symptomatic, then it's not really needed to test them. And if somebody's got symptoms, they need to be evaluated to make sure that there's not something else that can cause them, like the flu or just common cold viruses. Those things kind of need to be ruled out first so that the labs are not overwhelmed with the corona testing. And then if we do that, it takes longer to get results, and we put a strain on the supply for the test.
Yeah, because it's still regular flu season, and now we're getting into allergy season.
Right.
So
there's all kinds of explanations.
Respiratory symptoms, and I guess when you do evaluate them, you ask them if they've traveled anywhere and things like that. Okay.
Yes.
All right. This is one. Am I at risk if I leave the house, for instance, at the grocery store or at work?
Well, the risk is not that much different than just in general going out and being exposed to those common viruses that are typically out in the community: cold viruses, flu viruses, viruses that cause stomach illness. I mean, those are all things that you're at risk for anyway. So you wouldn't need to treat it any differently. So go to the grocery store. The things that we recommend, that we would encourage in any kind of respiratory illness outbreak season, is to wash your hands well, try not to touch your face with your hands, covering your cough, staying away from sick people if you can, and if you are sick, to stay home.
Yeah.
So I mean, those are not new, it's not new guidance, but it's something that people need to think about, especially right now.
Yeah. Just it never hurts to just overwash your hands, I imagine. Yeah. Okay. Let's talk a little bit about traveling. We were talking about this before we were on camera. Traveling on a plane. I know a lot of people were concerned about that. I'm concerned about that. Do health officials recommend we cancel our plans?
The CDC, on their they have a nice website. They do have a page for travel. They have right now 3 levels of travel. They are recommending to rethink non-essential travel. The level 3 is the highest. So those areas that they have determined have this level 3 warning, they don't want any, they're not recommending any non-essential travel to. Then they have some areas that are level 2, and what that means is that people that are elderly or have underlying medical conditions, those people that we found to be more at risk for the coronavirus to have serious complications from it, should try to defer travel to those areas. And then the rest is a level 1. It's the lowest. It's they're not recommending to defer your travel plans, but to kind of proceed with caution to make sure you're still doing those things, washing your hands and trying to stay away from sick people, and if you're sick, not to travel.
Yeah, because it's not just about you, right?
Right.
It's about the people around you. Yeah.